Thanks very much to the organizers for inviting us to share briefly with you today about World Vision's experience with the Photovoice approach. I'm Mary DeCoster, and I've worked for a number of years in international NGOs as an SBC specialist. I'm currently working as an independent consultant with colleagues at World Vision to develop a Photovoice training manual for community facilitators. I find Photovoice to be a very unusual and interesting approach. It's a community-based participatory action research approach that was initially developed by health promotion researchers Wang and Burris in 1997. It entrusts cameras to the hands of community members so that they can show strengths and concerns within their communities through photos. Photovoice research can range in complexity from very simple and straightforward to highly rigorous research projects. It can be used to promote critical dialogue and empathy about important issues from the point of view of a selected group of community members, and the findings are showed with key stakeholders to influence policy change and community action. You may already be familiar with the socio-ecological model. Photovoice is unusual in that it can work at any or all levels of the model, ranging from individual and interpersonal all the way up to public policy levels. Now I'd like to tell you a little bit about the Photovoice training manual for community facilitators. This is a highly participatory, user-friendly manual that uses the learning-centered or dialogue education approach, which was pioneered by Jane Vella and Global Learning Partners. Through this training, community facilitators learn to recruit and train community participants and lead the Photovoice process from start to finish, probably with a little support from staff specialists. This participatory method is highly effective because the learners learn by doing. They'll go through almost all of the steps of the Photovoice process themselves, so it'll make a lot more sense to them. It won't just be theoretical. The manual is near completion, and it will be pilot tested by World Vision Indonesia in December, and it'll be ready to share, we hope, in the first half of 2025. When planning for Photovoice, the community facilitators will learn how to make these three decisions. What's the story that needs to be told? The answer to this would point them in the direction of their study question or research question. Who needs to hear the story? This would help give them their intended audience. And who could tell the story? That helps them realize who the Photovoice participants need to be. It could be youth, elders, young mothers, truck drivers, or whoever is best suited to tell the story. After the Photovoice participants take the photos that respond to the selected study questions, they are helped to describe the photos using the SHOW methodology. Includes see, happen, our lives, why, and do. That's how you get the acronym SHOWed. So what do you see here? What is happening here? Why did it happen? How does this relate to our lives? Why is the situation like this, and what can we do about this? Question: why is it important to you to have access to youth-friendly healthcare services? Here is a possible photo and description that might respond to that study question. I hope you will have an opportunity to use the Photovoice and the training manual coming soon. And now my friend and colleague Sarah Bauler will share about a rigorous research project done in Mozambique.
My name is Sarah Bauler, and I am the Health and Nutrition Research Director with World Vision International, and I would like to take the next few minutes to discuss a Photovoice study that we conducted in Mozambique among adolescent girls. So during this Photovoice study, we used purposive sampling, and we selected 16 adolescent girls between the ages of 13 and 20 years of age. The participants were trained on the study objectives, the ethics and safety, and basic photography, and asked to take photos during a 1-week period. After the 1 week, we had the girls come back and we conducted 2 workshops. And then after the workshops, we conducted 16 follow-up individual interviews to learn more about the photos. And the photos were really used to elicit discussion to better understand the nutrition preferences and priorities and needs among the girls and in their food environment. Each participant was then asked to select one photo that best represented the challenges and opportunities related to their nutrition and health. And then we took these photos and compiled them and made them into a photo book. And then the photo books were then shared with key stakeholders of influence, and also the Ministry of Health, Ministry of Culture, and Ministry of Education. So after we conducted the workshops and the key informant interviews, we took the transcripts and coded them and looked for emerging themes around opportunities and barriers. So I'm going to discuss just very quickly about some of these emerging themes that we found. So first, under opportunities, the findings revealed that adolescents had a strong preference for locally grown food, including rodents. They expressed a strong desire to participate in agricultural activities, and most girls worked on their farm at least once a week, and they deeply valued family, friendship, and community. So if we looked at barriers, participants often define poverty as a lack of connection to people of power and influence rather than money. They had very little knowledge around nutrient content of certain foods, and there was an inequitable household responsibilities between girls and boys, which was very consistent in our analysis. Based upon our work in Mozambique, we developed some resources and guidelines. The first is a paper on social ecological framework for adolescent nutrition. The second is our photo book, and the third is our Photovoice guidelines. And we hope these resources are helpful as you explore Photovoice in your own work. Thank you.
If you'd like to learn more about Photovoice, there's a great publication available on World Vision's website called Guidelines for Photovoice Projects and Research, Learnings from Participants. So I really suggest you check that out. There's also a nice article called Photovoice, the Little Method That Could Change the World, available on the internet. And coming soon in 2025, the Photovoice training for community facilitators. Thank you very much for this opportunity to share with you.